is it is infiltrative. It has a lot of mitosis, lot of atypia, lot of necrosis, and a lot of vascular proliferation. So this is a very, very aggressive tumor, and it quickly starts from one part of the brain and it spreads to the other part of the brain, and that is why it is also called as a butterfly tumor. So this tumor is also called as a butterfly tumor because it starts from one part of the brain and it quickly spreads to the other part. So that appears like a butterfly. So it's a butterfly tumor. And if you look at the microscopy of this tumor, okay, if you look at the microscopy of this tumor, it contains the central area of necrosis. So it contains the central area of necrosis. So central part of the tumor has become necrosed and the viable cells are present on the periphery. The viable cells are present on the periphery. So what happens is that this tumor basically is growing like this. This tumor is growing like this. So viable cells are remained in the periphery. And what happens is, because the tumor is growing so rapidly that the blood vessel is not able to keep pace, blood vessels are forming rapidly. Blood vessels are forming rapidly, but they're not able to form as with that speed that they should form, but they're not able to form at that speed. So therefore, they form vessels which are not good. So these vessels are called as, what are these vessels called as? Glomeruloid vessels. Okay, so they are called glomeruloid bodies. Glomeruloid bodies are nothing but immaturely formed vessels. They are immaturely formed vessels and they have very high chances of rupturing and giving rise to hemorrhage. Okay, now since these tumor cells are actually sandwiched between the vessels on the other end and the necrosis on the inside, these viable tumor cells which are in between these two are made to stand in a line. So what is this appearance called as? This is called as pseudo-palisading. What is this called as? Pseudo-palisading. This appearance is called as pseudo-palisading. This is very characteristic of this tumor. And in the central part, there is necrosis. And this necrosis is not static. It's going to grow like this. So this is called as serpentine necrosis. This necrosis is keeping on growing. So this is called as serpentine necrosis. So whenever you look at this tumor has three important parts. The central part is the necrosis, which keeps on growing. So serpentine necrosis. There are viable cells which are sandwiched in the periphery. So they give rise to palisade, so it's pseudo-palisading, and these vessels are on the end which basically has a very high chance of rupturing, so they are called glomeruloid bodies. That is the classical microscopy of glioblastoma. So let's look at that so that we know that. Okay.